Welcome to CPT Coding Guidelines Review for Transcatheter Thrombectomy and Thrombolysis. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding transcatheter thrombectomy and thrombolysis. So, before we dive into the guidelines themselves, let's take a quick look at what thrombectomy and thrombolysis are. Both thrombectomy and thrombolysis are used to treat thrombi, or blood clots. Thrombectomy is a surgical procedure used to remove the clots through an incision or by inserting a catheter with instrumentation, either to break up the clot and retrieve the pieces or aspirate the clot. Thrombolysis is the administration of medication to dissolve a thrombus. The medication is delivered either indirectly through an IV or directly through a catheter inserted into the bloodstream and then advanced to the site of the clot. In some cases, both thrombectomy and thrombolysis are used. Thrombectomy and thrombolysis are used to treat deep vein thrombosis, pulmonary embolism, ischemic stroke, and coronary thrombosis. If you are interested in learning more about thrombectomy or thrombolysis, please visit the website at the URL shown here. Mechanical thrombectomy is reported with codes from the range of 37184 to 37188. These procedures include intraprocedural fluoroscopic radiological supervision and interpretation and intraprocedural injection of thrombolytic agents. Placement of catheters should also be reported. When performed, diagnostic studies, other percutaneous interventions such as percutaneous transluminal angioplasty or stent placement, and any prior or subsequent continuous infusion of thrombolytic agent are separately reportable. If mechanical thrombectomy is performed in a coronary artery, see code 92973 and see code 61645 for intracranial mechanical thrombectomy. Arterial mechanical thrombectomy is performed as a primary transcatheter procedure with pre-treatment planning, performance of the procedure, and post-procedure evaluation focused on providing this particular service. Typically, the diagnosis of thrombus has been made prior to the procedure, and a mechanical thrombectomy has been planned preoperatively. Primary arterial mechanical thrombectomy is reported per vascular family. Code 37184 is assigned for the initial vessel treated within a vascular family, with code 37185 used for the second or all subsequent vessels within the same vascular family. Treatment of an additional vascular family through a separate access site is reported with the primary service code 37184 with modifier 59 appended. Secondary arterial mechanical thrombectomy is reported with code 37186. A secondary arterial mechanical thrombectomy is removal or retrieval of short segments of thrombus or embolus before or after another percutaneous intervention. Do not report secondary arterial mechanical thrombectomy in conjunction with primary arterial mechanical thrombectomy codes 37184 or 37185. Code 37187 is used to report venous mechanical thrombectomy. If this procedure is performed bilaterally through a separate access, append modifier 50 to 37187. Code 37188 is assigned to report repeat treatment on a subsequent day during a course of thrombolytic therapy. Transcatheter thrombolytic infusion is reported with codes 37211 to 37214. These codes include fluoroscopic guidance and associated radiological supervision and interpretation, follow-up arteriography or venography, and any repositioning or exchange of catheter. Several procedures are separately reportable, including catheter placement, diagnostic studies, and other percutaneous interventions such as percutaneous transluminal angioplasty with or without stent placement. Ultrasound guidance for vascular access is also separately reportable with code 76937. For intracranial infusion for thrombolysis, code 61645 is used. Codes 37211 to 37214 are assigned based on which day of treatment is being reported. Codes 37211 and 37212 report the initial day of thrombolytic infusion. These codes are differentiated by whether thrombolytic infusion is being administered into an artery, 37211, or a vein, 37212. 37213 reports continued infusion or infusions on a subsequent day or days other than the initial or final day of treatment. And code 37214 is assigned to report the final day of a multi-day infusion. If bilateral infusion is provided via a separate access site, modifier 50 is appended to codes 37211 or 37212. For infusions initiated and completed on the same day, assign only the code for an initial day of treatment, 37211 for arterial infusion or 37212 for venous infusion. Evaluation and management services provided on the same day as and related to the thrombolytic therapy are included in codes 37211 to 37214. If a significant and separately identifiable evaluation and management service is provided by the same physician performing the therapy and on the same day of service, the appropriate level of E&M service may be reported. Modifier 25 should be appended to the E&M code to indicate the evaluation and management service was significant and separate from the evaluation and management inherent in providing transcatheter thrombolytic infusion. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review Series, as well as our full catalog of courses at hialearn.com.